Welcome back to the Lars Larson Show. It's a pleasure to be with you, and I'm glad to get your phone calls and your emails. You know, as we head toward fall, one of the key questions being asked not only by students, but by a lot of parents and entire communities is, we're paying billions of dollars for public schools. Are the public schools actually going to operate this fall? And is it safe to do it during the China virus pandemic? I thought we'd talk about that with one of our great friends of the show, Dr. Pham, who's a policy analyst at the Heritage Foundation, medical doctor, and otherwise a very, very smart guy. Dr. Pham, welcome back.
Thanks so much for having me.
So, listen, I get to hear both sides. I get people saying it's foolish to have shut down the schools. They're absolutely essential. They perform a, babysitting function. They also perform a feed the kids function, which I think are the lesser of the let's educate the kids goals. But I have people saying there's nothing wrong with it. Kids don't get it. Even the president says things like that, which I don't feel the need to agree on all things with President Trump. I also see places like Georgia, where they've said, we're going to reopen the schools, and they actually got started early this month in August, and they've found out that they end up with hundreds and hundreds of teachers and kids who've been infected. And while most people poo-poo the idea that, kids get it, they do get it. They don't get it as much as adults do, and they're perhaps not as good at transmitting the virus under the age of 10. But above the age of 10, in the teenage years, they transmit the virus almost as effectively as adults do. And there's a policy question there. Can you safely reopen the schools? So you're the doc. Give us the latest medical knowledge on this.
Sure. And that is actually a very good point, that the older students, they're going to behave a lot more, biologically going to behave a lot more like adults, because physiologically speaking, they're essentially adults, if not in behavior, than in physiologically speaking. So, there's much more of a question there with the high school students, but everyone below the high school age, or the grade school students, we still see very little transmission between students and from students to adults. In fact, from a student to adult, I don't think that's been documented. I haven't seen anywhere that transmission from a grade school student to an adult has been documented. From student to student has been documented. From adult to student has been documented. But it's very rare at the grade school level. And so at the very least, then, we should be okay with that. And I should also point out, this isn't necessarily about public schools. This is about letting parents or letting families decide for their household to return this part of daily life back to their kids. So whether it's public school or a school pod or a homeschooling co-op, these things should not be prevented from happening by the government.
All right, so what procedures would have to be put in place for a public school to reopen? And do we necessarily have to, I've seen numbers like 50 square feet per kid, which in most classrooms is going to mean a very small number of kids in a classroom. But I've also, and you may have been the one who mentioned it to me, Doc, and I'm sorry I can't remember, but there was a case that's, I think, pretty well studied of a couple of hairdressers, I think they were in Georgia, who didn't know they were sick, but they were, and they wore masks, and they served 138 clients. And, when somebody's cutting your hair, they tend to be in fairly close proximity to you, and none of their clients got sick. So with the right kinds of precautions, you might be, and most kids are not going to get that close to their teachers. Perhaps they will. But if you could do the right things, could you safely reopen at least the elementary grades, even if the high schools might have to go to more distance education or different things?
Right. So at the lower grades, at the younger ages, then I think that we can ask the students to try to follow certain precautions. Wear masks if they can. Most of them, it's not going to be realistic for a kindergartner to wear a mask all day. We can ask them.
If you tell them it's a game, they might be glad to do it, Doctor. Maybe it's the way you ask them.
Well, I don't have kids, so I haven't actually tried to make them win a game of wear the mask all day. But we could ask them to, and we can try to work with children. Just the main goal is to try to minimize the number of unnecessary contacts. So keeping students within a classroom or within a grade, so there's less intermingling, less. Minimize faculty-to-faculty contact and stuff like that. There are ways to minimize the risk, and we should be following those things. But overall, we're seeing again and again from experiences all over the world that the grade school level is probably going to be one of the safest things that we can reopen. But as with all things in this, the risk is never zero. It is just very low, and it's the active goal. It should be the active goal of the government to release some of these restrictions that they put on us already.
And maybe as you start to get some experience in operating that way, say, okay, we figured out we don't need to do this anymore. Be as willing to take rules off as you are to put them on. Is that fair to say?
Right, and then also the reverse. If we're seeing some breakdown in the procedures, then maybe like a different rule can be in place. Like you should be flexible at the local level. Should be flexible with adding or subtracting rules as necessary.
Now, I mentioned you're a medical doctor, but Doc, did you ever work as a clinician?
Outside of med school, no. I went after med school. I went to an MBA school and started getting into policy.
I guess I was just going to tell you, one of the things that drives me nuts about government is everything is one size fits all. So when you talk about the schools opening, it's never, maybe we should open the elementary grades, but not the high schools. We'll find a different solution for them. But it would be like if you as a clinician, a doctor who sees patients every day, said, I'm going to treat all my patients the same, whether they're 7 or 75. And I would say, well, that doesn't sound very smart, Doc, because you have to have different solutions for Mrs. Johnson, who's in her 80s, than you do with Jimmy Johnson, who's 8 years old. And they would think you were crazy if you operated that way. But the government tends to say, the school's either all open or none of them open. And you think, well, hold on. Can't you have individualized solutions depending on differences like above 10 and below 10? I don't see anybody in government proposing those kinds of solutions.
Exactly, and that's exactly how we need to be approaching this, different levels of precautions. We talked about how physiologically teenagers are going to be much more similar to adults. Well, the nice thing about teenagers is that they're more able to comply with some of these restrictions that we have. Like, I would not expect a first grader to wear a mask all day, but 14-year-olds can probably do it. Not necessarily well, but they can probably do it. We can ask them to do other things. Like, they can comply with these a lot better, and they're the ones who are going to be at a little bit more risk than the younger students. So the solution should be tailored to the age, to the locale, to the community. But, when governments come down and say, this is how it's going to be, then they're going to miss out on all these opportunities.
Hey, what do you think? Joe Biden just came out today and says if he becomes president, he wants a mandatory 3-month mask mandate for everybody in America. What should we think of that?
I mean, as we were just talking about, having this blanket mandate is not going to be very effective. It's going to be far overreaching. And he said in his little press briefing, sorry, forgot the words, but he said that you should be wearing a mask every time you're outdoors, and that's just not the case. Even if you're going to the grocery store, then you should probably put on a mask if you're in a grocery store because you get social. But from the car to the grocery store, you don't necessarily need a mask there. So having this mandate is just going to have you can't have a mandate without enforcement. And if you're going to enforce this thing on people, you're going to enforce people to wear a mask at the most ridiculous times possible. So it's not going to help the cause of public health.
Doc, I got to tell you this. You mentioned you haven't raised kids. Everybody who has, when they heard you say it's easier to get 14-year-olds to do things, they either drove their car off the road at that point or started laughing, I think.
I heard myself say that, and I understood what I just said. But, they can follow rules for a little bit. Their attention span is a little bit longer, even if their willingness to follow the rules is not there.
No kidding. Dr. Pham, where do you write? Where can we pick up your writing at Heritage?
All my latest stuff should be on thedailysignal.com. I'm going to have some more things out on heritage.org. Both those places will have my latest work. And
is it all friendly for those of us who don't have MD at the end of our name?
That is exactly the goal that I go for, and that's it's one of the core competencies of medicine, even though we're not very competent at it, is explaining these things to people who need to understand it.
Dr. Pham, you're the best. That's Dr. Kevin Pham from the Heritage Foundation. We'll be back in just a moment. Glad to get your phone calls and emails at 866-439-5277. In a moment on the Radio Northwest Network, we'll talk with our illegal alien watcher.